The objective of the Bolero-2 trial was to look at a drug called Everolimus in the use in metastatic breast cancer. It was a double-blinded, randomized, institutional phase 3 study where they took Everolimus in conjunction with open-labeled exemestane or placebo with open-labeled exemestane in patients who had progressed after one AI and had metastatic disease. And the primary endpoint was progression-free survival. The findings of the study were, again, the primary endpoint was progression-free survival, and it did show an advantage of Everolimus at approximately 7.4 months versus about 3.2 months superiority over placebo and exemestane alone. The poster was to basically do an overview of the Bolero-2 data in the use of Everolimus in postmenopausal metastatic breast cancer, but really to talk about the side effect management associated with this drug. Everolimus is an mTOR inhibitor, so the side effects are pretty much standard across the board with mTOR inhibitors, but specifically the ones that we're looking at are stomatitis, which is mouth sores, pneumonitis, as well as rash and anemias. So those were kind of the ones highlighted, and then how to manage those side effects. So I think all of us understand from a nursing perspective that it's really hard to manage stomatitis. There aren't a lot of tried and true things out there from a research standpoint, but I certainly think from a clinical standpoint, we know that there are several things that we can try, such as asking our patients to avoid spicy foods, hot foods, asking them to chew on ice, using steroid rinses, using things like Miracle mouthwash or viscous lidocaine for comfort. So that in terms of the stomatitis is what we talked about in the poster. Pneumonitis is really about grading the pneumonitis and when is it important to stop the drug, knowing that this is a non-infectious pneumonitis. You can use steroids if indicated in a grade 3 pneumonitis. Stopping the drug, allowing the patients to get back to baseline, and then re-challenging the patients at a lower dose of the drug. Anemia, pretty much the standards of anemia, transfusion if patients are symptomatic, the use of epopoietin or Procrit to help boost the hemoglobin in patients, again, who are symptomatic. Rash was kind of the other one that we talked about a little bit, and in terms of rash, a lot of, again, clinical things such as asking patients to use a lot of moisturizers, taking cooler showers as opposed to hot showers. In cases where it's more problemsome in terms of the itchiness, using some topical steroid creams, as well as using things like Aveeno baths, which are sometimes quite helpful. I think it'll be interesting to see when the drug gets FDA approval and it comes onto the market to really help our patients to be well educated in what the side effects are, early management of the side effects, so that we don't have to interrupt drug therapy.